Welcome to Creating a Family, talk about infertility. Today we're going to be talking about the impact of over-the-counter medications on fertility and pregnancy. You know, we tend to think that over-the-counter medications are no big deal. I mean, anybody can buy them, right? So they must be totally safe. Well, we're going to dig a little deeper on that. Today, we're going to be talking with Dr. Kathleen Tucker. She is an embryologist with a doctorate in reproductive physiology and over 25 years experience as a professor and an IVF laboratory director. She now has her own consulting business, K.E. Tucker Consulting. Welcome, Dr. Tucker, to Creating a Family. I can't wait to dive in on this topic.
Thanks, Dawn. I'm really excited to talk to you about this too.
I am a person who really loves to dig into the research, and I found some interesting research which cited 3 reasons why the impact of over-the-counter medication on fertility was becoming an increasing issue, and one that healthcare providers as well as patients need to be thinking more about. One, they noted that people in general are taking more medication now than people in the past. Also, people are waiting longer to start a family than previously, which is associated with greater medication use just because of age. Also, people who are experiencing in general more chronic disease at earlier ages, and hence taking both more prescription and non-prescription medication. So taken together, these factors have increased the number of prescribed and over-the-counter drugs that men and women are taking at the time when they are considering or trying to conceive or are pregnant. So does that fit? I know that you spoke on this topic at the large American Society of Reproductive Medicine meeting. Did what I was just telling you, does that fit with the research that you have seen as well?
Oh, yeah, absolutely. Especially the part of, they're over-the-counter medications, it's no big deal. That's actually, when I was thinking of an introduction to this topic, that's exactly what I was thinking. Oh, we take them for granted. Over the years, our intake has increased substantially. Like, for instance, in the U.S., talking about men right now, men undergoing infertility, 68% of men 18 to 44 years of age and over 80% of men 45 and older are taking some kind of prescription or over-the-counter medication. And what's interesting is that coincidentally, 26% of these men that are over 45 years old are becoming parents for the first time. And so they're taking all these medications and they're trying to start a family. So, that's where there's the rub, as they say. For women, the statistics of how much they're taking in a non-pregnant state is not real clear, probably as much as you and I are taking. But for those women who are, for instance, pregnant, I have a statistic that it was quite an eye-opener. Depending on who you read, it can be anywhere from 90 to 94% of all pregnant women are taking some kind of medication. And and this doesn't count vitamins or herbal supplements. So that's a very high confounding amount of people taking drugs at a time when you think that could be very detrimental.
Mm-hmm. And so what we're going to do now is try to dig into what we know and then what we don't know about how these medications are impacting both the attempts to get pregnant as well as pregnancy. And let me just stop and point out that for the patients, as always, talk with your doctor about any concerns you have regarding both prescription and non-prescription medication. However, for the healthcare providers, I think that the take-home message is going to be to come to an understanding, find out what medications including herbal supplements, but your patients are taking. That it's going to be vitally important, and we'll circle back to that at the end, because I think that we're going to learn more about which specific type of medications we need to be worried about. Now, we're going to be talking about classes of medications. We're going to be focusing on over-the-counter, but in some of these classes, there will also be prescriptions, and when we have and when the research has given us information about the impact from prescriptions, we will talk about that as well. And we're going to be talking about the impact in 4 different time periods. One, the impact on fertility general, both female and male, for people who have taken the medication in the past. Now, impact when these medications are taken during treatment. And third, impact when the medications are taken in pregnancy. And then fourth, impact on the child if the mother took the medication during pregnancy. Again, we won't have information. There's not research or definitive research on all 4 of these potential impacts for each class of medication. But that's the general approach we're going to take, and we're going to share what we know now from the research. All right, let's start by talking about nonsteroidal anti-inflammatory drugs, NSAIDs. They are a popular pain reliever and anti-inflammatory, obviously. And we've got, I think, 5 basic categories. 1, aspirin. 2, ibuprofen. 3, naproxen. 4, celecoxib. And 5, acetaminophen. So let's talk in general about those. And I know that aspirin, let's save aspirin to the end, because aspirin is a bit of an outlier and has some really interesting research about that. All right, so what do we know about starting in that first time period, people who have taken these medications in the past? Let's say the non-aspirin ones, but the others. Is any research indicating that they can impact female fertility?
The nonsteroidal anti-inflammatory medications, at least the research I came across for healthy premenopausal women, is that if you follow the manufacturer's recommendations, there isn't a direct effect on anything that would affect your fertility. It doesn't affect ovulation rate. It doesn't affect your menstrual cycle length, things like that. It doesn't affect your fertilization rate. Just if you're healthy and you have no conditions, you are of normal body weight, also very important, and not taking a myriad of other medications that can conflict, then it should have absolutely no effect. And so quite the contrary is if you are having an indication where you need to take one of these NSAIDs, then you're it's better for you in the long run to go ahead and handle that fever and take care of that inflammation and reduce that pain than whatever minor impact it might have on your fertility rate after that. Because these injury conditions can cause much more damage than the amount of medication a healthy woman would be taking.
So what about during treatment? A woman has come into treatment and is beginning the treatment, and she is, let's say, both just a periodic or a routine, either one. Are these medications safe for her to take?
Yeah, as far as I know, yes. It's not a big deal. In our experience, again, we'd rather have. She's taking a lot of hormones. She's she's menopausal one day and then hyperstimulated the next. She's estrogen poisoned. Her system is going all over the place. Estrogen is an inflammation modulator, so she'll have headaches, she'll have body aches. It's everything. So if she can take some Tylenol to reduce that, it would calm her down, and that will help a lot in this period of time. And if she's not smoking is a big one, but we're not talking about that today. But in a healthy woman beginning infertility treatment, her biggest adversary is stress. Anything she can do to minimize physical and emotional stress, she should try and do. Now, we're not talking handfuls of Tylenol or ibuprofen or anything like that. Following the manufacturer's recommended dosages, try and use as little as possible. And I'm going to mention acetaminophen because that is the one that is considered the most safe. It has a lower blood thinning component to it. So that's usually the first line of defense for any kind of inflammation or pain or analgesia. So
would that be the same now that we were talking in treatment? Would that also be the same as pregnancy as well?
Yes. That's the most highly recommended analgesic for during pregnancy, and I think I have a statistic for you on that one. Somewhere around 65% of pregnant women take acetaminophen.
Gotcha. Okay, so we've had a long time, a lot of research on acetaminophen. And as far as the others, if you have been taking it in the past, obviously you check with your doctor. But if you have been taking that in the past, ibuprofen, naproxen, Celebrex, any of those, then there would be, you check with your doctor, but you might well be fine if your doctor says it's okay, taking as prescribed or as the directions say on the bottle.
Absolutely. These the ibuprofen is still the jury's a little bit out on that as far as during pregnancy. It has an FDA categorization of C or D, and they do recommend not taking it in the third trimester of pregnancy. For some reason, I could not find that study. So it might be that if your headache can be alleviated by Tylenol, which is more highly recommended, and that's a category B medication, which means that there's no well-known studies in humans, but animal studies show no adverse effects on the fetus. The benefits outweigh the risks. It's considered safe during pregnancy. Ibuprofen is still considered safe during pregnancy if that's the only thing that's helping you with fever, with headache, with migraine. If you're getting relief from that at the normal dosages, the FDA would still say if the benefits outweigh the risk, it's safe to take. It's not a category X, which means, put the skull and crossbones on that bottle. So,
okay. And let us, I think that people probably know this, but when we speak of ibuprofen, the brand names would be Advil and Motrin. When we speak of naproxen, the brand names would be Aleve, Anaproxen, how do I say that? Naproxen? Naproxen. And celecoxib is Celebrex, and then, of course, acetaminophen, the Tylenol. So those are the brand names for people to clear them in. All right. So what about these have been around for a while, particularly ibuprofen and acetaminophen have been around for quite a while. Any indication from the studies you've seen that there is an impact on the child if the mother took any of these medications during pregnancy?
No. There's been no follow-ups on childhood health from women taking these particular NSAIDs. Nothing that stands out now. Mm-hmm.
All right. So now what about men? Anything, again, we're saving Ashram. We're going to be talking about that in a minute. What about men? With these other NSAIDs?
Well, interestingly, their biggest problem tends to be with Tylenol, where it's quite reversed in the women. There's been some studies that shown it can affect seminiferous tubule morphology, where the sperm are produced. This is, of course, in animals, in rats. It's hard to see that in men. But you see they have shown more significantly more abnormal forms and more sperm DNA fragmentation in humans. Taking Tylenol can lower the motility already in infertility patients. Plus, there seems to be a significant time to pregnancy lag period for men who have been taking chronic Tylenol or acetaminophen. So, and they think that it might have something to do with testosterone synthesis. So
that's interesting.
It has it's in a normal healthy male that produces 1 billion sperm per ejaculate, not going to be an issue. If you're undergoing infertility treatment because you have a male factor issue, yes, it's important to pay attention to these things.
So for a normal man, a slight impact on the motility would probably not matter because there are so many sperm. But for someone who are for unexplained, or for actually anyone, it seems to me, coming into treatment. So what is the preferred NSAID for men For women, you said it's acetaminophen, but what about for men?
Well, again, quite the opposite of women. Ibuprofen has probably the least studies that show any detriment in humans, and there's only one animal study, and otherwise there's nothing done in human. There's nothing adverse about ibuprofen, so it's probably the safest for men.
Fascinating. Okay, and let's just keep in mind that what we're speaking of is taking it as prescribed, because ibuprofen does have an impact on other parts of your body. We're speaking only about, liver and others. So we're only speaking about the impact on fertility.
Correct. Taken as directed.
All right. Mm-hmm. Taken as directed. And keep in mind that a lot of times what people don't realize is some of the cold medicines and other, or even headache medicines, are actually a combination of NSAIDs. And so you need to read the ingredients on anything you're taking to see the quantity you're getting, because you may be thinking, well, I'm not taking Tylenol, I'm taking Excedrin, and actually Excedrin, I believe, has Tylenol in it. So
exactly right.
All right. So now let's talk about aspirin. We saved aspirin because aspirin is special. So what do we know about aspirin? It's it is the oldest of all of the NSAIDs.
Mm-hmm. It's acetylsalicylic acid. I guess we all know Bayer aspirin. That's been around since I was a child, so Lord knows that's a long time ago. And it has two main effects. One, as an inhibitor of platelet aggregation, so it increases blood flow and circulation. So people who have had any kind of arterial disease, blood flow disease, they will take aspirin. Now, and that will help with circulation to their extremities. It also is an anti-inflammatory. So if you have an injury or a headache or pain or swelling, aspirin is very effective in reducing the inflammation. But what's come to light recently, and it sort of stems from the work with cardiac patients who have chronic cardiac disease, they have a higher level of inflammation due to their cardiac issues. And they found that low dose aspirin, which is like a baby aspirin, 81 milligrams a day, as little as that, can substantially reduce their chance for any kind of major cardiac event. And so going with this, there's been some really nice research looking at low dose aspirin, both on the circulatory side and on the anti-inflammatory side.
But let me stop, because most women, although we are waiting later to start families, most women have not waited so late it's cardiovascular issues are relatively rare in the reproductive age childbearing female population.
Well, let me tell you some other causes of chronic inflammation in women that will affect their childbearing issues. For instance, it can impact steroidogenesis. So the making of estradiol. It can affect the meiotic and cytoplasmic maturation of the oocyte, resulting in low fertilization rates. And low ovulation rates. Overactive inflammation has contributed to preterm birth, pregnancy or spontaneous early pregnancy loss, gestational diabetes, and preeclampsia. These are all inflammatory states that we live with all the time. Pregnancy is a low-level inflammatory state. But the reason I bring up the cardiac patient is because they found that there is a marker for the level of inflammation that you're undergoing, and that is the high sensitivity C-reactive protein. It's a biomarker of the level of inflammation. If this marker is high, your level of inflammation is high. And you will get the most benefit from a low dose aspirin therapy. If your inflammation marker is low, not such a big effect. And this is done in patients as well. And we see some improvements, significant improvement in clinical pregnancy rate and live birth rate in these patients that have this high serum marker. So it's we learned something from our cardiac patients that does affect human reproduction. And other sources of inflammation are any of the autoimmune diseases, lupus, for instance, rheumatoid arthritis. That that you can get that as a child, and you're living
Yeah.
with a chronic level of inflammation all your life. And if this level of inflammation is elevated for some reason, that can even lead to certain cancers. So it's important that the low-dose aspirin therapy is kind of a big deal. I was convinced.
Yeah, although there's been some recent, in the news anyway, discussion about it not being used over the board, just across the board, because the benefits necessarily, because there is some risk associated
Of
with.
course.
Yeah, but I've read some interesting research a year or two ago about increased success, and it seemed like it was fairly significant with frozen FETs, frozen embryo transfers, where the woman was not going through a egg retrieval cycle, but was coming back after the eggs had already been retrieved and embryos had been created, and they were being transferred into her uterus, and that low dose aspirin was effective. And are you familiar with the research I'm talking about?
Yeah, it was a very nice study done in Iran, actually. It's a double-blind study. Coincidentally, I know all about it. And they, this was, during their frozen embryo transfer. So they did have some hormonal stimulation beforehand, but mostly just to synchronize the uterus with the stage of the embryo that's being transferred. And they showed a significant improvement in live birth rates, not just implantation rates, but in live birth rates over patients who did not receive this low dose aspirin treatment. And they would have started right the month that they were be considering the transfer. So that was very compelling. And this would probably cater more to they believe that this effect of the aspirin had to do with increasing the local circulation of the uterus. There has been historically, and I know people who've done this, patients who have difficulty having an implanted embryo and carrying a pregnancy, they would be prescribed injectable heparin. And heparin, as we all know, is a potent blood thinner. And this had some positive effects. So there is some basis to this thought process, that it isn't just out there, oh, let's try some aspirin. And for these particular patients, this seemed to help quite a lot. Another study that was done earlier, they did the same thing only with fresh embryo transfer, and they saw no result. But then later, a meta-analysis, which is an analysis of several studies all together, it increases the power. So there are more patients included. There was significance in the clinical pregnancy rate, not necessarily in the live birth rate, but they're starting to see it. The more patients they get, the more you start to see maybe there's something to it also in the fresh transfer. The problem with the fresh transfer is these women are really poisoned by hormones. So you're counteracting estradiol, and that's your biggest inflammation modulator, as I mentioned before. And that's a hard one to overcome. So it might be that you need more patients to show an effect. And, it's interesting. And at least they've showed that it doesn't hurt. If it might help, why not? And it beats getting heparin injections.
Well, that's for sure. But so again, this is something from a patient standpoint to talk with your doctor about, your reproductive endocrinologist about, and if and for the medical professionals, it's certainly worth researching further the research.
Exactly.
To see whether or not it's something that you want to recommend for your patients.
Yeah, absolutely. We need more carefully controlled studies, and maybe try to repeat the frozen transfer studies. Perhaps in our clinic in Holland, where I used to work a few years back, we use natural cycle frozen embryo transfers. So these patients, they would ovulate, and then we would synchronize from there. And this would really be the type of patient you'd want to, carry on this study. Yeah.
Yeah, interesting. All right, so now we've talked about women with impact of fertility on women with aspirin. What about men? Anything we know about the impact, what aspirin does for the fertility of a male?
It's not heavy. There's one study that showed a decrease in testosterone production by the Leydig cells, um, and um, and another hormone reduction by the Sertoli cells. These are the two cells that line the seminiferous tubules and produce testosterone and nurture sperm production. So there is a moderate disruption in the normal endocrine profile at the level of the seminiferous tubules. Again, for a healthy male, not an issue. If he likes aspirin, he can take an aspirin once in a while. If you have 5 sperm, maybe an issue. If we're reducing your numbers even further, and even if we're going for the procedure called ICSI, which is intracytoplasmic sperm injection, you need to have a few to choose from, and at least in Europe, or at least in Holland, these sperm had to be motile, not just alive, because you can have living sperm that don't move, but these sperm have to be motile. So anything that will disrupt motility or numbers in sperm, especially, and like I said, in these highly infertile patients, you will just say, stop taking them. Absolutely. Find an alternative or have a headache.
Yeah, it's worth for the short term, particularly from the man standpoint.
Correct.
Okay, excellent. Let me pause here to tell you about this show is underwritten by Ferring Pharmaceutical, and they want you to know about an app called Ferticom. It's an app for your phone, either Apple or Android, developed by reproductive psychologists Dr. Ali Domar and Dr. Elizabeth Grill. Both have been on this show. I like them both so much. And they designed this specifically to help women address the challenging emotional situations that infertility can bring. And they use cognitive, behavioral, and relaxation techniques. It's a great app. It is free. You can get more information about it at ferticomapp.com, FERTICALM app.com. All right. I want to talk now, let's move to talking about a different class of drug. Let's talk about antacids in general, and I also would include in that proton pump inhibitors, which are, again, both over-the-counter as well as prescription. So antacids, let's talk about what they're for, and then let's go through the 4 areas that we're looking at impact. First of all, so what is, I think most people probably know, but what are the different types and classes of antacids?
Well, you sort of mentioned that there's the histamine blocker. These medications act by binding to the histamine 2 receptor, as opposed to the normal antihistamines, like for allergic rhinitis and hives and the like. This binds to the H2 receptor. And basically what it does is it prevents gastric acid production by the gastric mucosa of the stomach. And those are the histamine blockers. And common ones are Tagamet, Zantac, Pepcid. And then the other type you mentioned, the proton pump inhibitors, these act a little more downstream, inhibiting the potassium proton pump that also participates in the secretion of gastric juices in the stomach. And these are considered to be slightly more effective. And some of these you might have heard of is Prilosec or Prilosec OTC, Nexium, and Prevacid.
Okay. Now, let's start with how these might affect the general fertility of women.
Well, very honestly, as far as in the non-pregnant state, there's no significant impact on ovulation, fertilization, anything like that I've seen in the literature. The big impact is during pregnancy, if there is an impact. basically they are considered safe to use, but there are some, there were no big differences between whether they were the histamine receptor blockers or the proton pump inhibitors.
Okay, so you're saying that from a fertility standpoint, research really has not found that either of the histamine blockers or the proton pump inhibitors, the two classes of antacids, there really isn't an impact on female fertility. And during pregnancy, they're considered safe as well.
Yes, actually, especially the H2 receptor inhibitors, so Tagamet, Zantac, Pepcid, they're considered category Bs, very safe. But interestingly, a few studies showed that there are no differences between the receptor blockers or the proton pump inhibitors during pregnancy. So even though their categorization is a tiny bit different, they're still considered safe, and that the benefits outweigh the risks during pregnancy.
Okay.
And if I may interject, there's actually one
Sure.
study where they were concerned that in older adults, the use of what they call anti-reflux agents, which is essentially what we're talking about here, it could contribute to osteoporosis or fragility fractures later in life. Mm-hmm. And so there was a study done, not necessarily on the woman, but on her child. And they found that these anti-reflux agents not only did not contribute to a higher incidence of fractures, but there was actually significantly fewer fractures in these children when compared with control patients who did not take anti-reflux agents. So There you go.
There you go. Well, that's a shocker. I would not have anticipated that.
Would not either. That was like, really? And why? And I'm thinking the mechanism of action, but that's for another time.
Yeah, well, that's what I'm thinking too. I was trying to figure out why. But we should point out that one study does not a conclusion necessarily make. So we find it interesting. But whenever I see a study like that, I am dying to see it repeated and with larger groups, of course, just because that's fascinating and. So I'm keeping my fingers crossed that somebody is doing the research on that.
Well, and also that the patients have been conscientious enough to keep up with it and to stay in touch and to continue to send in feedback and information, because that's the hardest thing with these long-term studies, sociology studies, is that you lose touch with the patients, they just lose interest, and there are quite a lot of patients included in these studies. So there's something going on. It's worth another look. But as you said, you're absolutely right. One study does not dogma make. But the other thing too is that the point is it's not only is it not detrimental, it may even be helpful at some level. So that's how we have to look at it.
All right, let's talk about the men then. Impact on fertility for men. We'll talk both about the histamine blockers as well as the proton pump inhibitors, which are the two classes of antacids.
I don't have information on the proton pump inhibitors, but I do have it on the H2 receptor antagonists, and it's very much medication dependent. Here we looked at Tagamet, Zantac, and Pepcid, and the one with the biggest problems is Tagamet. And I've heard there was some reports many years ago, 30 years ago, that Tagamet, at least the prescription form, caused erectile dysfunction. So there is something to some of these studies. More recently, just looking at the effects on sperm, we see things in decreased number, decreased qualities, lower viability, lower testosterone, more DNA damage, quite a lot of work. And half of it's done these are studies in humans as well, not just animals. So this is one of those medications where you would say, you know what, let's take something else. Let's take maybe some Pepto-Bismol instead of this stuff, because this is very detrimental to sperm. I see this, and I would actually recommend to my patients, don't take this.
So that's Tagamet. And so
Tagamet. Mm-hmm.
So Zantac or Pepcid would be the preferred.
Yes, and both of them nothing real substantial. So, the conflicting data, nothing where you can say, oh yeah, that's a real problem. And so again, it's one of those situations where benefits outweigh the risks. Those two would be perfectly fine if you're undergoing infertility treatment. If you're not, and Tagamet works for you, well then of course, okay, again, in high dosages, that whole erectile dysfunction issue could be a big problem.
Yeah, and erectile dysfunction can impact fertility, obviously. All right, so now we've talked about the antacids. Let's talk about antihistamines. There are different classes of those. If you could explain what the different classes are, and how they differ as far as their mechanism of working, and then let's talk about the impact starting with female fertility.
Okay, yeah. Antihistamines work by binding to the H1 histamine receptor and blocking histamine release and histamine function. And histamine is a modulator of inflammation. So anytime you can, and the results of the inflammation can be anything from a runny nose, itchy eyes, to anaphylactic shock. So it's a very broad range of effects by histamine. So we have two generations of H1 receptor antagonists, and the first one is called the first generation. And the first generation includes medications like chlortrimeton or Benadryl. And these molecules can cross the blood-brain barrier and resulting in sometimes somewhat adverse reaction, such as drowsiness. So,
oh my gosh, yes.
Yeah, and some people like it if you're flying and they'll take a Benadryl and go to sleep, or in Advil PM or any of the PM medications you were talking about combinations. There will be diphenhydramine mixed in with your analgesic, so your headache's gone and you want to go to sleep. So, but they are both considered Category B by the FDA, so seemingly uneventful during pregnancy. So not a lot of research. If you're trying to get pregnant and taking antihistamines, again, this is going to be my mantra, that the benefits outweigh the risks. So the next group is something we're much more interested in, and those are the second generation antihistamines, and these are the quote unquote non-drowsies, things like Allegra, the Zizal, Zyrtec, Claritin, and they are the ones that are most often recommended would be Claritin and Zyrtec. These are both class B, and they're both of them have shown no adverse effects for the fetus, for the mother, before pregnancy, during pregnancy, and I found there's a paper, and for some reason I couldn't access the whole thing, but there's been a lot of mention that Zyrtec actually helps with the nausea and vomiting during pregnancy, in morning sickness.
Huh. Interesting.
Yeah. And that was the one when I went into this chat room, I was curious because they were talking about it. And one woman said, "Are you sure it's not something else?" And said, no, Zyrtec, for sneezy, for the sneezies, runny eyes. And she says, it works like a charm. And I read this in a few peer-reviewed publications, and they also mentioned this. And I thought, well, that's something and there's a paper that was written in 2000, and they don't, online you could just get a little snippet of it, but not much on the mechanism of action. So I have to try and persuade them to let me buy it. They're giving me some trouble with it, but it's, those are long story short, the antihistamines as a group, whether they're first or second generation, are safe.
All right. So then let's talk about, and that's safe. And I'm assuming that there has been, we've talked about pregnancy, but I'm assuming that there's no research that would indicate that children born of mothers who took either Gen 1 or Gen 2 histamines have had any adverse reports.
No, I have seen nothing that mentions anything that affected the child.
Okay. Now let's turn to the men.
Okay.
Yes, antihistamines. Either let's start with generation one, which again, that we think of that being the drowsy ones, which Benadryl was the one that comes to mind.
Okay. There is some effect about there was some research on Benadryl. So there was Benadryl can affect viability of sperm.
Not
But
motility, not
that's
motility, but
not
viability.
motility, viability. So you would have more dead sperm.
Yeah. Hmm.
And that's it. Chlorotrimazole, there was no research on that whatsoever. So the first gens, not terrible, but there are other options available. For the second gens, the only one that actually had a positive effect was Zyrtec, and they showed that astenosospermia. Well, actually, no, I'm saying it incorrectly. Zyrtec, once they stopped taking it, their semen analysis improved. So it did have some effect on the number of sperm available. And they think that it has something to do with the Sertoli cell itself, that it affects the cell that nurtures the sperm during its development. And that these cells start to die when you're taking a Zyrtec.
And it occurs to me from the healthcare provider's standpoint that what this tells us is the importance of getting not only the information on the woman, but also the information on what type of medications the man is taking.
Absolutely. Especially if he's the culprit, if the infertility situation lies with him, then absolutely. But even if he's just middle of the road, you don't want to set him up to fail. And anything that affects the DNA of the sperm, we would, even if it was just in animal work, we would recommend that they stop taking that particular medication, switch to something else, because we do have, especially with the antihistamines, there are others to choose from, and let them and then wait 3 months, because 3 months is approximately one spermatogenic cycle, and at the end of the 3 months, you have a whole new set of sperm that don't have that DNA degradation, because there are procedures where, well, we don't need a lot of sperm, and they don't have to be supremodal as long as they're still alive. If there's something wrong with the DNA, then injecting the sperm serves no purpose. You're taking an abnormal sperm and creating an abnormal embryo with it. So
right, and the chances of that embryo implanting and growing into a healthy baby are very small. So
yes,
exactly. So going back. Did I understand you that the only one that showed that researchers has said you should not use would be Zyrtec?
Has the biggest effects, as far as I can tell. Yeah, the others don't. The research is sparse, if there's anything at all. The one that has absolutely no information on it is Allegra. So then you have a patient who has terrible allergies. I would just say, switch to Allegra for 3 months. And there are other options. Now, the one thing that we didn't discuss with women that is important with men are what they call mast cell inhibitors. And these are also antihistamines by blocking the source of histamines, which is the mast cells. And they can actually have a restorative effect on sperm. So in men who have, it does seem to promote better spermatogenesis.
What are some of the brand names of the mast cell inhibitors?
These are actually not over the counter yet, but they might be eventually. But for instance, one is Tranlast. Another one is called Zatador. I think that's in... it might be available here, but it's available also in Canada. And those two are the biggest ones. There aren't so terribly many of those because they work well, but they're not as fast acting as the histamine blockers are.
All right. Let me pause now to remind you that this show is brought to you by the support of our partners. And these are organizations and clinics who believe in our mission of providing unbiased, medically accurate information to the patient community. And some of our wonderful partners include Schrafft's 2.0. They are a specialty fertility pharmacy that believes pharmacy care can and should be remarkable. All employees, from their pharmacists to their shipping coordinators, understand the stress of fertility treatments and are trained to treat customers with dignity, empathy, and respect. And we also have Cryos International, both sperm and egg bank. They are dedicated to providing a wide selection of high-quality, expensively screened, frozen donor sperm and egg from all races, ethnicities, and phenotypes for both home insemination as well as fertility treatment. They are the world's largest sperm bank and the first freestanding independent egg bank in the United States. All right, I want to talk now about some dermatological products. Now, that's an interesting one because I think that oftentimes we think of over-the-counter medications as being a pill that we take. So when we're moving into talking about dermatological products, is that anything that we need to worry about? Is that considered over-the-counter?
Yeah, they're only over the counter at these concentrations. What I've read, and it doesn't. The biggest concern was not prior to pregnancy, but during pregnancy, that certain ingredients need to be you need to be cautious about them. And there is an organization called the American College of Obstetricians and Gynecologists, and they have a website that outlines which products are safe and which products should be avoided during pregnancy. Like, okay, here's and I read there are a couple articles. One was an article that was trying to raise awareness to warning labels on these creams. For instance, there is some women have problems with what they call melasma, or getting dark spots during pregnancy. And so they will use these skin bleaching products. And one of these creams that's available has something called hydroquinone in it. And hydroquinone, and this of course is right now studies in animal studies, is highly carcinogenic. And there's been some, not studies necessarily, but investigations in humans, and the results are kind of inconclusive. But if you can avoid using a cream that's carcinogenic while you're pregnant, and we're talking carcinogenic effects on the fetus, by the way, not just to the mother, that maybe you would avoid taking these medications. And in addition, we were talking about category X. There's something here that actually could probably be included in category X. There are many creams available now that have vitamin A precursors in them, retinoids, retinoic acid, anti-wrinkle cream, for instance. And,
sure,
and
exactly.
some women like it for stretch marks and stuff. Well, the retinoids are actually very detrimental to the fetus. And there's one form of it called isoretinoin. And this results in severe birth defects in fetuses, mostly neurological. So it leads to intellectual and brain disabilities and defects. So this is a big one that even the FDA says avoid at all costs. Do not use this.
And this is over the counter or prescription?
Yeah.
Wow.
Yeah.
And do you know a brand name? Do you know a brand name with that?
No, I didn't get that far. I'm sorry to say, but again, it's what you mentioned earlier. Read the label.
Right. Read the label.
And there are a list of ingredients that are perfectly safe. Benzoyl peroxide, azelaic acid, I'm not sure what that is. Salicylic acid topically, also not a problem. And glycolic acid, these are all things that will also help bleach the skin and get rid of some of those dark spots. But those are safe to use.
And could you please say the website again that lists the dermatological products?
Yeah, if you go online and search for the American College of Obstetricians and Gynecologists, they will have their frequently asked questions, and it's frequently asked questions number 169, and it will give a list of things that are safe and unsafe during pregnancy, and the creams are one of them. And that, but a study led me to that website. So that's how I found it. I said, all right, well, let me see what else they have in there. So it's very informative. These little things it can be very helpful to patients as well. And as also, this is something that maybe the healthcare provider can have maybe on a pamphlet and say, hey, if you have any more questions, just go ahead and click onto this website. And this has been fairly well shown by not just by government officials, but by people who deal with pregnant women all the time.
And it's also a word of warning to healthcare providers to suggest creams that their patients may be using, because honestly, most people don't think of their anti-wrinkle cream and as being a over-the-counter medication, nor do they think of a bleaching substance for pregnancy dark spots as so it behooves the medical profession to ask, to specifically ask to help trigger ideas whether or not that matters.
Yeah.
All right. So before we move on to talking about herbal supplements and vitamins, are there any other medications that we need to know about that would impact fertility before or during treatment? Or let's focus on those two.
They're the one thing we could spend hours discussing as well is if we started talking about prescription medications, the list will go to the moon and back. Again, with any of these medications, I know for a fact that certain antidepressants in men will cause their sperm membrane to be altered in such a way that they don't bind normally to the egg. This is a problem. It can be alleviated by the ICSI procedure because it doesn't seem to affect the DNA of the sperm, but they will, if you're trying to do normal insemination or regular IVF, you need to know what kind of antidepressant your husband is on, if he's on any, and if he can get off it for a short term, because it is reversible. That's the joy. Then he can stop it. There's also the same situation with certain beta blockers in men. That's the biggest problem we find, is that it's in men. It does have an immediate effect on the actual binding of sperm, and which you can test. Again, maybe they can go to an alpha blocker or some other kind of hypertensive medication that doesn't affect their sperm, and for 3 months. But if in the case that they're on a specific medication and they cannot change it, there are doctors that says you cannot just switch like that, then we can offer them something that where instead of regular IVF, we might do half regular IVF and half injection. And that way they will end up with something fertilized at the end of the day. And it's also very diagnostic for us. It tells us, okay, whatever hypertensive medication you're on, this one does not affect sperm binding. So you have very good fertilization, or maybe it does. And then we have the injection side where we can choose embryos from. So it's, again, as you said before, you have to take a lot of research with a grain of salt, because it's not 100% for every patient. Some patients are very sensitive, and this is how it manifests itself. And other patients, you see no effects whatsoever. But do you want to risk an IVF cycle just to see? So that was our answer for the medications that he couldn't change and that might be risky, and that worked out extraordinarily well for us.
Okay. And like you say, with men, if a man has a normal semen analysis, it becomes less of an issue. Unless it's affecting the DNA, and then that would
correct. But usually, if there's a problem with the DNA, you see other issues. You see morphology; they don't look right, they don't swim right, lots of double heads, things like that. There are other flags that fly around. It's not like, ooh, they're so pretty, but their DNA is garbage. That's very rare. So.
Okay. All right. Now let's talk about something that a lot of people don't think at all is they don't think of it in terms of medication because they're not necessarily taking it for medication. And that's, let's start with herbal supplements, but let's include vitamins.
Well, Vitamins. That's a sticky wicket a little bit. Generally, most multis are pretty good, well-tested formulations. And when in doubt, I would say to my male patients, if they're saying, well, what do you think if I take this? Or what do you think if I take that? And I'll say, well, that's fine, but I would recommend a man's multivitamin and make sure that those ingredients are in there because they'll be in there at the right percentage.
Well, no, you're saying you're making a distinction, if I'm understanding you correctly, about rather than taking the vitamins individually to get a multivitamin that combines a number of vitamins, the name, and then, but that they are doing that, but that the combination is in the proper percentages.
Absolutely right. You got to me before I could say it because I was saying I'm of the school where I take my vitamins separately, but then I pay attention to what I'm taking and I don't overdose on one. But I know that in my fertility patients, if a little is good, a lot is a whole lot better. And especially, there's been some press on zinc, that zinc can help infertile men. Yes, and if you are zinc deficient, zinc will help you. If you are not zinc deficient, you only need a small amount of zinc because it is a heavy metal. It will build up. It can be toxic. You don't want to take a whole bottle of zinc. If you have a cold, you probably have a system that is zinc deficient. Then it will help you, that type of situation. But the best thing for these guys is a multivitamin. And if they're really particularly stressed, and you can tell, take 2. Take what's in the bottle. Sometimes the manufacturer recommends 4 a day. That's okay because they're in the proper balance, in the right proper ratio. So you're not creating an artificial imbalance of something. And that's the thing we have to watch out the most in men.
Okay, so what about with women?
Well, with women, it's pretty straightforward. Prenatals, they're very, very good. Folic acid, don't go without it. That's very important, not even just for pregnancy, but when you're trying to get pregnant, that seems to have some help. Any of the B vitamins are very helpful because they're the first that are depleted in a stressful situation. So, if you get a good prenatal vitamin, that tends to check all the boxes. And again, I always tell people, I said, if you're feeling particular, like you're not eating right, you feel that you're not eating right, take another one. It's okay. And they usually come back and tell me how great their hair looks, that type of thing. So.
You're right. For women, because we're recommended to take the prenatals when we're trying to get pregnant.
They're good. They're good generally. They're just a little bit, if you're stressed, if you're running ragged, going here and there, the ultimate soccer mom, and you're just beat, prenatal vitamins, they're just a little bit more of everything. And that's what, you need because you're not eating it. Balanced meals. Our foods these days just don't have the nutrients they did 20 years ago. I'm starting to sound like my mother, but it's true. It's just not how it used to be. And so we do need supplements. But supplements only really help when there's a deficiency. Otherwise, you're creating an artificial imbalance. And that's what we have to watch out for as far as vitamins are concerned.
All right. Now let's talk about herbal supplements.
Yeah, that's a little bit of the black box. The thing that got me with the herbal supplements is by themselves, if you're taking nothing else, they're probably okay. And I know that women love to take them because they think, oh, they're natural and they're just going to be good for me. And they'll just counteract everything else that I did today. And if I take this tea or this green drink or whatever, but we know for a fact that many of our prescription medications have come from plants down the road. And so we have to take this all with a grain. I found a very interesting paper that just described a list of things that we take on a regular basis, things like chamomile or cranberry, ginger, ginseng, and sage, and then listed, if you're taking other medications, how they can either exacerbate a symptom or counteract the functioning of your prescribed necessary medication. And so that was a real eye opener.
But we're not talking necessarily about consuming eating cranberry muffins, or ginseng tea, or adding sage to your stuffing. Or are we, from my understanding, that we're not necessarily talking about consuming this in the proportions when you're eating food.
No, exactly. We're just discussing supplements, because if you go to an herbalist, they will put these dried herbs in little capsules, and you will be taking them at a much higher level than you would normally. And you wouldn't just be taking one a day. You'd maybe take 4 or 5 or 6 a day, handfuls. People who, like, for instance, with ginger, people will make tea out of ginger. They will eat ginger, and you're infusing dried ginger in water, and then you're drinking it. And I use that as an example because we all love ginger, but when you take it at higher levels, it exacerbates. If you're taking insulin, for instance, it amplifies the effect of the insulin, causing a hypoglycemic situation. So these things they interact. And that's what I was bringing up. It's like, you have to be careful, because some people, you have to take insulin. But if you're pregnant and you're taking insulin, and then you say, oh, my stomach's upset, I'm going to have ginger tea. I'm going to take my ginger pills, because you can buy that. And it'll settle my stomach. And then she starts getting the shakes because she's hypoglycemic. And, you don't want that. That's what you don't want. And so it's just everything you're taking in large doses, in concentrated form. Be cautious. There is information out there. Your pharmacist might know. A dietitian might know. There are even herbalists out there that probably know what natural products are safe to take with whatever medication you're taking, or even if you're just taking their aspirin therapy. Some things can counteract or can increase the blood thinning effects of the aspirin, stuff like that.
Is there anything that you would specifically recommend that people avoid? Let's say women or men avoid when they are trying to get pregnant, either in treatment or out?
Nothing that leaps out. Just, something that, no. That wasn't saying, oh my God, don't take this, you won't ovulate. To be honest, even if you're eating a lot of soy, which has, the phytoestrogens, you'd have to eat so much to really affect your normal estrogen levels. This is as a healthy, normal, cycling woman, that you can't even change the length of your menstrual cycle with that. So I really think that by itself isn't such a big problem. During pregnancy, again, by themselves, these things are harmless and maybe help you, but in combination with what you're taking. And that's really the only point I was making. It's like, if you're going to take some of these supplements, these herbal supplements, just like taking a vitamin supplement or another kind of medication, be aware what else you're taking and see if there's any harmful interaction between the two.
Okay. Well, this has been so interesting. Thank you so much, Dr. Kathleen Tucker, an embryologist and a reproductive physiologist, for talking with us today about over-the-counter drugs, the impact, and very interesting. And I really appreciate it. I think it will be helpful for everyone. The views expressed in this show are those of the guests and do not necessarily reflect the position of creating a family, our partner, or our underwriters. And keep in mind that the information given in this interview is general advice. To understand how to apply it to your specific situation, you need to work with your infertility doctor. Thank you so much for joining us today, and I will see you next week.